to eat or not to eat? Now that's a good question. Yes, no, yes, no, yes. Who cares? Probably so. Hey, when it comes to taking your medication, especially in the morning, it's difficult sometimes to decide whether you should eat or not. As a matter of fact, most of your medications will tell you somewhere on the label whether it suggests you eating with the medication or waiting a while. And that makes difficult decisions, especially in the morning if you're a person like I am who likes to get up and go, who likes to get on the move. We don't like to drag around. We just want to eat a meal and keep going, because to go without that meal, that important meal called breakfast, can be very, very detrimental to your day. So what do we do if half of our medications say to eat and the other half say not? My name is Jim Merle, and I'm the Transplant Helper. I want to help you with this question today. Now, this question comes really from a viewer question, one of those I've thought about many a times, but I got it from a viewer, and I wanted to pause and answer it today. Should you eat or not with your medication? In general, I would say yes, just go ahead and eat. For the most part, when these medications warn you not to eat, all they're really saying is that you can have a little bit of an upset stomach. And you know as well as I do, in most cases with most of these medications, if they're going to cause an upset stomach, and if you're prone to that, it's going to happen anyway. So you may as well enjoy your meal and then move on with your day. However, there are a handful of medications such as, and if I can find mine quick enough, such as your Prograf or your tacrolimus, which actually it does matter just a little bit, especially if, say, it's clinic day and you're going to have your levels checked on your Prograf/tacrolimus. It really does matter. So it's important then, and in that case, not to eat in around the time that you took your medicine, so that, or in order that your blood levels on the Prograf can be checked properly. Now, again, it's not a life or death thing. If you eat and the medicine says no, or you don't eat and the medicine says don't, you're probably not going to die from that. Howbeit, you may actually cause a little bit more of that stomach upset, or even lessen it. That's up to you. Now, many doctors have prescribed us with different medications that we take orally that help us along the way with those stomach upsets and all that. That's a side note. That's for a discussion in another day. But as far as I'm concerned, ignore what your bottles say for the most part, unless your doctor tells you different, and just eat. Just enjoy your meal. It's important for us as transplant patients, especially anyway, to make sure our blood levels, as far as blood sugars, as far as our hydration levels, and all those things are in balance, sometimes more than it is just to pay attention to what's said on the side of a medicine bottle. And again, these are overall blanket precautions. They may not even affect you. I have a stomach of steel for the most part. I can eat anything, so it's really not an issue. But nonetheless, I would suggest just go ahead and eat. You're better off at the end of the day to eat and take your medicine. Now, if this has helped you in any way, let me encourage you to like, subscribe, and share this video as far and wide as you can. While you're there beneath this video subscribing, go ahead and hit that bell notification. It'll let you be notified every time I put out a new content, new program, which comes a couple of times a week, and you can use that as your reminder to watch, and maybe you'll get some great quick tip like this. Again, I appreciate you joining me, and until next time, stay stronger, friends.